Good evening. Thank you for joining us. I'm Faye D'Souza. This is Live with Faye. We've had some worrying news on the COVID front, specifically with the numbers. And that's why we've decided to have this conversation to register for our audience, at least, what these numbers mean and whether or not we ought to be worried about it. As always, one of the voices I respect and rely on a lot, and I have done so since the pandemic broke out, is Dr. Shahid Jameel, who's a virologist who has been advisor to the government and who's really been the most reliable and stable voice through all of this. Dr. Jameel has been kind enough to give us his time. Good evening, and thank you for joining us. Going through some of the data we're looking at right now, Doc, Kerala has been reporting more than 20,000 cases per day for over a week. India has reported now more than 40,000 cases a day for the last 5 or 6 days. And also we're seeing Karnataka and Tamil Nadu now bringing in some restrictions, closing their borders to Kerala. It seems like a repeat of what we saw at the beginning of the second wave. The Delta variant has made its way across the world and has made people in many other countries sick as well. We have a new sero survey from ICMR that tells us that in cities like Delhi, the prevalence of antibodies is much higher. In places like Kerala, it's lower at about 40%. So I just wanted to put all of this data in perspective and understand what this means. When you look at the numbers coming out of Kerala, is this a suggestion that we are beginning a third wave? Is it too early to say that? Or is it the tail end of the second wave? How are you reading this?
Yeah, so Faye, I don't think that just looking at Kerala, you can say that the third wave is beginning to happen. You're right. I mean, Kerala is possibly showing the continuation of the second wave. It's not over there yet. And that's made very clear by the fourth sero survey that ICMR has put out, which showed that while there is an average of about 2/3 seropositivity in the country, which means that about 2/3 people have been exposed on average. Kerala, it's only 44%.
Yes.
So Kerala has done quite well in containing the numbers in the first wave and in the second wave. So on average, there are more susceptible people in Kerala than the rest of the country. And we also know that the Delta variant is very infectious. In fact, now CDC US is saying that Delta is as infectious as chickenpox. And we know how infectious chickenpox is. This is bound to happen. But, much is being said about Kerala just by looking at the numbers, and it's being said that Kerala has really lost the plot because 35 to 40% of cases in the country are coming from just Kerala. I don't think so. I think what we are seeing in Kerala is simply the fact that they contained very well earlier, and there are a lot more, naive people, unexposed people in Kerala.
So Doc, does that mean that if a state government does well to contain the spread of the virus in wave 1 and wave 2, then it's eventually going to get everybody? I mean, that's what it sounds like, which is that because if Kerala managed to contain, that the virus is going to continue to sort of plow through their population.
Yes, what you don't want is a huge spike in cases on a few days, because that will overwhelm the healthcare system. And this is what we saw pretty much all over India in the second wave. But that we didn't see that happen in Kerala. And so Kerala is sort of continuously flattening the curve so that numbers never go beyond the healthcare capacity. And if Kerala is putting out roughly 22,000 cases per day, that's well within their capacity to manage it. So I think that's been their strategy, to test at scale and to make sure that the numbers don't go out of hand. I mean, if you look at death, for example, death is an indicator of severe disease and pressures on the healthcare system. The death rate in Kerala is half the national average. So those are also the numbers one needs to look at. If you look at the tests that Kerala is doing, they are doing roughly 4,500 tests per million population. For India, which has an average of about 1,200 per million tests per day. So, it's working well on several other metrics. We should not simply look at the daily numbers and isolation.
That's really interesting, because we have had some people on Twitter say the Kerala model has failed, that it's not really working.
No, that's very simplistic.
Yeah, your argument is that it is working, and that's what we're seeing right now, an actual model that seems to be working. Also, I mean, anecdotally and otherwise, we see the US is showing a spike right now in their cases. Europe, countries like France, for example, are showing a spike again. Does it mean, Doc, that we are in an endless spiral of waves? That, whether it is variant or otherwise, whether, we've had some research that tells us that the third wave, if it does come in India, is not going to be as severe as the second wave, but there will be a wave. So how many waves should we really be prepared for?
Well, we can't predict that. The next wave will depend upon whether there will be a far more infectious variant than Delta. And I think it will be very hard for the virus to top its performance with Delta. It's a very, very infectious virus. What we are seeing in US and Europe is really the result, and these are countries where vaccination has been going on for much longer than India, and they have more vaccines available, all of that. But remember, they also have more vaccine hesitancy. US will never go beyond 50, 60% simply because 40 to 50% people don't want to take a vaccine. That's not the case in our country. In our country, vaccine hesitancy is very low right now.
Yes. But vaccine availability is also very low now.
Yeah, availability, yes. I know that's a challenge. But one hopes that in the months to come, that will improve. Our vaccination rate, as per the government plan, is running roughly 7 to 8 months behind schedule. That's a reality. We have to accept it. But there are other interventions through which we can protect ourselves. And I've been saying continuously on your show and other places that don't worry about this variant or that variant. A good mask will prevent all variants. And we worry a lot, but we don't do what each one of us can do. And we must continue to do that.
Yes. And that's actually very beautifully said. So you basically said that instead of panicking about another wave, or instead of panicking about another variant, if we continue to wear our masks, maintain social distancing, continue to sanitize our hands, that is good enough against any variant. Coming back to the question of vaccines, and I won't ask you because we've been through this so many times about a vaccine policy in India and the good decisions or bad decisions. We've seen some countries now make decisions to do booster shots, which is they're giving their people the third shot, because there's research saying that some of the antibodies are waning. Whereas the WHO has come out to say, do not do booster shots in favor of those who have not received a single shot yet in many other countries. Where do you stand in this? What does your research tell you? Will we all need booster shots? Because then we're looking at the next 3 years of vaccines?
Possibly in a year or two, but definitely not now. I think people are panicking because after vaccine, they measure antibodies in their blood and find that either the antibodies are too low or not there. But what they don't see is the cellular immune response, the T cells, which you're not measuring when you're simply doing an antibody titer. That will protect from disease. And these vaccines have never claimed that they will protect from infection. They will protect from disease, and the real world data on vaccines shows that they are protecting. They're protecting against alpha, they're protecting against beta, they're protecting against delta. In fact, they're protecting better against Delta than they're protecting against Beta, for example. My view on that aligns with what WHO has been saying. These booster shots right now is a luxury of countries who have already hoarded a lot of vaccines. 60% of vaccines have gone to countries that have only 15% of the world's population, whereas only 1% of Africa has been vaccinated. Now, the trouble is that if this virus continues to spread and mutate in Africa, it will come back to US and Europe and everywhere else. So we have to understand that if vaccines are the major tool in this fight, then vaccine equity and vaccine access is also very important. So instead of, going with booster shots just now, which is barely, less than 6 months after completing the full dose in some of those countries, I think we should hold on and make sure that vaccines go to places where they haven't gone yet. That's very important. The virus will continue to mutate if it is left unchecked.
Do we, in India, are we vaccinating fast enough to be able to stand up to a third wave? Or can we take the sero survey that says that 2/3 of us already have antibodies in our system as, perhaps a second shield against the virus?
Yeah, so it is reassuring in some sense, I guess, that, we have 2/3 who have been exposed. But I must caution that the danger in this is that 10 to 30% people who get infected, whether they show symptoms or not, have long COVID. That's what global data is showing. So I would caution against this strategy, and that's even more reason to continue to protect ourselves. Don't get into this mode that, you are helping herd immunity. We don't know at what level herd immunity will come with this infectious virus.
Well, I do want to ask you this. There's a question that's coming from Pooja Kenge, who says, will this be dangerous for children? And there's been some research that said the third wave will affect children because they weren't affected in the first and the second wave per se. Is there enough research to conclude that? Is that something that you find,
Well, look at the sero survey data from India. 60% children and adolescents have antibodies. So what does that tell you? It tells you that children got infected just as well in the first wave and the second wave. Maybe a little less, maybe 5 or 6 percentage points less than adults, but that's not statistically significant anyway. So children got just as much infection as everyone else. So I think this whole premise that since we did not see children coming to hospitals and in ICUs, that children have not been infected, that's the wrong assumption. The sero survey tells you the right picture.
There's a question from Kunjal who says, how much damage will it do to my lungs if I get COVID twice? Or does it have to do with the severity of the COVID that you get?
It would have to do with the severity. Yes, and it's hard to say because different people react differently to the same infection. But yes, if you've had pneumonia both times, then you need to be careful. But if you've had just an upper respiratory infection and it cleared off without lung getting involved, then you're all right. You're fine.
Doc, is there in India right now studies on how we are reacting to our vaccines? Because the Indian government was fairly late in making the decision that pregnant women should also get vaccinated, that lactating women can also get vaccinated. But is there an active study on the ground to tell us if there are any adverse reactions to these two groups of people, if there's any effect on the children when they're born? Are we actively studying this reaction?
I'm sure it's being studied, but it's too early to tell because India has started vaccinating pregnant and lactating women only very, very recently. And I don't think they would even have had the second dose, just one dose so far.
So it's still early. It's still early to make that decision. Is it safe to assume that the third wave is inevitable?
Well, if you ask my opinion on this, then I really think that a concerted third wave may not happen. But then, I could be proven wrong. There would be outbreaks in different parts of the country which would be offset by one another, depending upon the prevailing local situations and the positivity already there in that particular state, that community. And, when staggered outbreaks combine, you will get some kind of a national wave. So, I think first of all, it won't be nearly as bad as we have had the second wave. But, the third wave will depend upon whether a more infectious variant comes within the community. I think, topping Delta would be hard for the virus.
There's already a Delta plus, which in my last conversation with you, you said that there's no evidence that Delta plus is more dangerous than Delta in any way.
And see, where has it gone? Has it expanded? Not
No.
really. Not really. Delta is the dominant variant, not just in India, but everywhere else, simply because it just infects so very well.
So we have one person asking, Krishna Datta says, what is the percentage chance that someone who's vaccinated may get COVID again? And I'm going to expand the question a little bit. When somebody is fully vaccinated, which is 2 doses, they can still get infected.
Yes.
But the chances of them being severely sick because of COVID come down drastically. The chances of them dying of COVID come down almost by 99% from what I understand.
Yes.
But the question is, does it stop them in any way from being carriers or infecting other people? Because we've seen a lot of, now there are decisions even globally saying, okay, if you're double vaccinated, then you can travel, then you can do this, then you can do that. But does it stop me from being a silent carrier and infecting non-vaccinated people?
Yeah. So what happens is when you are fully vaccinated, yes, you can still get infected, but you won't have disease. And this is not special for COVID vaccines. There are several other vaccines, very successful vaccines that show the same effect. You get infected, you don't see disease. A classic example of that is the seasonal flu vaccine. You take it, instead of being down with flu for 3 or 4 days, you feel a little, low for about half a day, and then you're all right. So you're infected, but you don't get disease. And it's the same here. So in that scenario, what happens is that the virus infects and it replicates, but it doesn't replicate, it doesn't multiply to very high numbers. And the probability of transmission is directly related to the viral load in you. So if the viral load is kept low because of the vaccine, then your chances of transmitting somebody else is also reduced.
Yes.
Reduced, but doesn't go down to 0. So it's important to understand that.
Right.
Science does not provide you completely black and white answers. There is nothing like yes and no. There will be a lot of gray areas, especially when we are trying to understand a disease, a pathogen that is so new to us. So you will have this back and forth. It doesn't mean that science is not working. It doesn't mean that vaccines are not working. It simply means that we've not had enough time to have studied this and understand everything around it. Simply that.
Well, we have a question from Aman Peshawari, who said, if we look at Europe, cases are rising, but not many people are being hospitalized or showing symptoms. If the third wave in India comes with that sort of safe effect, will there be another lockdown? Can the economy sustain it? I mean, that's the other question of, social distancing, which means offices can't open, which means our economy is going to have to continue to take the beating that it's taking. But is there a toss-up in your mind? Because just to give you, today we had, the Maharashtra Chief Minister consider the possibility of opening up the trains again in Mumbai, which we know are massive, sort of carriers. We've had many states now reduce their restrictions. They're opening schools in many of the states across the country. Where's the balance, Doc, between, maintaining the restrictions and being cautious, like you're saying, there's no blank check even from a vaccine. You have to continue to be cautious and sort of opening up and going back to normal life.
So, Faye, it's all about risk versus benefit. If the risk of opening school is more than the benefit of an education, then you don't open schools. But I think we've gone beyond that. That was there definitely in the second wave. And first wave, we knew so little about this virus that we had to do that. But I think it's time to open up, and time to open up cautiously, offices, schools. But you take precautions. So for example, in schools, before you open schools, make sure that all teachers are vaccinated. Just like, you make sure that all healthcare workers who work in hospitals are vaccinated. And it is just not acceptable for healthcare workers to exercise their freedom of choice and not get vaccinated. They may not care about themselves, but they are in a profession where, the safety of others depends on them.
Yes.
So I would say the same for schools. Make sure the teachers are vaccinated. Children don't get, moderate or severe disease. So I think it's a risk worth taking, because the impact on education and the impact on livelihoods has been awful. We just need to get out of this.
Dr. Jameel, thank you so much for giving us time and always being so patient with our questions and generous with your time. We appreciate it. It's a pleasure to speak with you. For our audience, the news is up at exactly 9 o'clock. Do take a look at it. Also, a happy announcement. Our startup, Free Media Interactive, from which you get all of this content, has been chosen among 65 other independent newsrooms across the world for funding from Google as a special grant. We will use the money to buy equipment, to set up a live studio, and to improve our offering to you of news that informs and doesn't give you opinions. Thank you for your support. And I want to thank all of our guests and all our audience, especially those people who come in regularly to watch our content and tell other people about it. Thank you so much for your support. It's going to be our endeavor to continue to bring you good, solid, news-based content. Stay tuned for